In talking about the disease of obesity, one of the things that keeps coming up are these gut hormones, and one of the hormones that comes up a lot is a hormone called ghrelin. Now, ghrelin makes you hungry. In fact, it's the hunger hormone. So it makes sense, right? As you are anticipating eating a meal, your ghrelin level rises, and it turns out that as the ghrelin level rises, the body is getting hungrier and it's setting up to store that energy unless you're going to burn it. And then after eating, the ghrelin level falls and it tells you, whoa, we got plenty of food, better stop eating. So ghrelin is part of the story. We know that the FTO gene influences this ghrelin as well. That's the genetic part of the disease of obesity. And now we also know that the mindset itself affects ghrelin. Now, we always talk about in our program of mindful eating, enjoying what you're eating and trying to nurture yourself with a small amount of really nutritious, luxurious food and being present while you eat leads to increased satiety. But we have a study now out of Yale University that really ties this whole mindfulness in very, very strongly. It's a brilliant study. So Dr. Crum at Yale University and her colleagues got together 46 patients. And the 46 patients were either normal weight or slightly overweight. And they had a variety of ranges. And what they did is they asked these patients to participate in a study rating milkshakes. And one of the milkshakes was called the indulgent milkshake. And it was 620 calories on the label. And it was supposed to be like full fat, all the goodness kind of a milkshake. And the other milkshake that they wanted the study participants to rate was called the sensible shake. And the sensible shake was 140 calories, kind of low fat, really good diet kind of milkshake. And the study participants would come in, they'd get their blood drawn, and then they would read about the milkshake, and the two labels are here. And so here they are, the two labels. One of them is called the indulgence milkshake, and the other is called the sensible milkshake. And you can see on the labels the nutritious part, or the nutritious facts are listed, and it goes through, the indulgence one is like 49% fat, 30 grams, and the other is no fat at all. And what they found in the study was that in the indulgent milkshake, the patients were anticipating this great milkshake, and their ghrelin levels were rising, and their psychology questionnaires were saying, boy, I'm getting hungry on this, waiting to eat this indulgent milkshake. And then, and most importantly, after they ate it, the ghrelin levels fell. And that falling ghrelin is what we want for patients because it makes you feel full and gets your metabolism going. For the sensible milkshake, the ghrelin levels really didn't rise much at all. They kind of stayed flat, and the patients didn't feel a lot of anticipation in eating. And then after they ate the sensible milkshake, the ghrelin levels didn't really fall that much. And that's really not what we want for patients, right? We want the patients to have a good ghrelin fall. And as it turned out, the milkshakes were exactly the same. And that's the punchline. So the fact that the patients believed that the indulgent milkshake was this high-fat, wonderful luxuriousness caused the ghrelin levels to behave far differently than the sensible shake version. And again, this is all psychology. The milkshakes are exactly the same. So that doesn't mean cause and effect for the disease, but it really speaks to the idea that the disease of obesity includes our mindfulness and not just being aware of what we're eating, but really trying to enjoy it and anticipate the meal and have a better ghrelin response to help your body's metabolism work better. And that should help in the fight of obesity. I'm Dr. Robert Woodbury at Healthy Steps.